Hi, my name is Jo Formosa from Health Dynamics, and today we're going to talk about that metabolic syndrome, the silent killer that a lot of people don't really realize that is underneath the surface that could be causing some challenges. And if you don't have or have an idea of what to test or are getting yourself tested, some particular blood test is some main indications that this could be this silent killer that is building. So like cardiovascular disease, it takes 30 years for cardiovascular disease. Metabolic is 10 to 15 years. And before you know you have type 2 diabetes, you're already in metabolic syndrome. You already have insulin resistance. So how do we know some of the things and signs to have a look at? So one of the things that you'll see in this article, I talk about the different tests that we have a look at. We look at fasting glucose. So a lot of clients that I see that come from different physicians will ask, can you show me what your bloods are like? I haven't had blood tests for a very long time. Okay, so when was the last time? I can't remember. I haven't been to the doctor for like 5 years. And these are people who are in their 40s and 50s and possibly even 60s. We look at our clients at least once per year doing routine blood check, because your blood test is giving you a little bit of a peek inside of what's going on under the hood. Now, bloods are the last place usually where some of your results will be, because blood will steal from all other places to keep major organs alive. So by the time you see it in the blood test, it's already been happening for some time. So one is the fasting glucose. So that's a test that you want to have a look at, and that's looking at measuring overnight how that your body recovers from that. There's also an insulin one as well. So I tend to test both the glucose and the insulin. The other one is an oral glucose tolerance test. So some of you may know that, especially if you've had children, where they like to do that. When you're drinking a glucose solution, it's how you tolerate that. It's not my favorite test because I think putting in that amount of sugar is a bit of an impact, but it also gives you a good indication if you have type 2 diabetes. So if you suspect it, it's actually a good thing. And the other one is HbA1c. So this is a test that reflects like what is the last 3 months of your blood results in the sense of the blood sugar level. So it's a really good indicator to see how things are happening in the last 2 months, because also what you ate the day before can sometimes, skew the test as well. So having those 3 to 4 tests are a really good way. The other one I look at as well is the liver reading, because liver is important, because liver is important for your, blood glucose as well, in how it's, flushing the toxins out of your body, and also helping, with when the liver's job is to clean the body and to regulate and help the pancreas regulate these insulin levels. Both of these organs work together. So in Ayurveda, we talk about the liver and the pancreas and the gallbladder are pitta-related organs. So they work to metabolize things in your body. So if there's a metabolism issue, some of these organs, start to have sympathy for each other. So, historically, like we have advanced a lot. Historically, something that they used to look at is tasting the urine. And they call type 2 diabetes like sweet urine, and prema in Ayurveda in Sanskrit, which means the same thing, like sweet urine. So what is the reason and what is the problem with metabolic syndrome? It is a silent killer. So it is the lead to cardiovascular disease. So if you have these challenges, it can lead to multiple things. So if we catch it early, we're actually stopping you from problem with the cardiovascular, which can be like more of a silent killer because you don't know it's coming, and then all of a sudden there's a heart attack. The other thing that's really important is how your body is using its glucose to deal with your muscle tissue, to deal with fat metabolism, to deal with energy levels. There is 2 types of diabetes, type 1 and type 2. Type 1 is an autoimmune diabetes, but also we have seen when we are managing diet and lifestyle, that also needing for insulin is less as well. So there's lots of things to have a look at. One thing I want to talk today is have a good read of the article, but if you don't know that maybe you are suffering with metabolic syndrome and you don't know that you are, this could be a key indicator to do something about it now. I'm going to show you a client of ours. I'm going to share my screen. a client of ours who I have seen with metabolic issues, and this is just having a look at her bloods, right? So this is the HbA1 that I talked about. So over 6.5, you're starting to look at type 2 diabetes. So we were working with her, but then the HbA1c, IFCC started to really drop. So we're now knowing that we're getting out of that reference range. So look at this, on metformin, no meds. So she was taking diabetic meds, and we were set to manage her without it. The other thing, a lot of the other things were happening. Potassium was better, urate was better, creatine function, which is the kidney. Look at this random glucose. So 12.3, now 4.9. So how she was dealing with glucose and how she was metabolizing, even on no medication, was actually even better than when she was on medication. Bilirubin is also like a liver enzyme, like a liver indicator. You've got all of your liver enzymes. They were all not, this is what I'm talking about, looking at the liver. And then everything came into a nice reference range as well. And then she had transferrin. So we have a look at all of these different levels. Ferritin, looking at, the iron level and things like that as well. And just looking at all the immune system as well. Immune system wasn't coping and functioning very well, but as we started to stabilize everything became better. So if you don't know or have a look at it, we were looking at this very, very regularly. This person came into me with severe anxiety, stress, weight gain, metabolism issues, tiredness, fatigue, joint pain, all the things that happen usually because of this inflammation. Metabolic disease causes a lot of inflammation. And when we went and started working with her on the diet, the lifestyle, we used specific herbs to help her liver work better and to help her to detoxify, but also help her to metabolize better as well. And then we use specific Ayurvedic herbs that is used for diabetes to start reversing that process as well. So keeping an eye on her with those things, everything started becoming better because we made the different strategies. What I always say to clients, you can't manage what you can't measure. So by measuring it, it really helped her to have an idea of what is the process that we put in place. So this is a subject that happens a lot. This is a subject that we talk a lot because we have a lot of clients that come in that go, I can't lose weight. I've got so much fluid retention. I've got so much inflammation. I have so much pain in my body. Well, there may be something more deeper. It's maybe a metabolic issue, and it may be a metabolic syndrome. And maybe your doctor is saying everything is good, everything is in reference, but we're looking at things moving. So when you have a look at it, and if things start moving and moving in the wrong direction, you are going into pre-stages. So like a doctor will say, your HbA1c is like, at 5.5, everything is good. But when it starts to go over, we're looking at, going into the 5.6, right? It's starting to get to a point where, oh, now you have like diabetes. So it's not about one day you're here, the next day you have the disease. You are pre-diabetic, and then you have all these indicators that are saying that you have metabolic syndrome. So one really big tip is making sure that you're exercising, because you have glycogen and these stores in your body that your muscle needs to use. And if you just go for a walk after you eat, it's a really good way for you to start to metabolize some of those sugars and things like that. It is a big subject. It's like a whole, semester course on knowing how all the metabolic syndrome works in your body. But in simplicity, knowing what you're eating, looking at your lifestyle, looking at measuring things, and getting yourself into good shape. So come and if you have any issues, we also have an inflammatory workshop coming up. So if you want to know more and you want to understand more about inflammation in your body, and you want to be able to use some herbs and some diet advice and things like that as well, come and join the inflammation workshop, because you will find out so much about your body. You will learn and be educated that things will just change and make huge difference as well. So hope to see you there. Take care. Bye.